Hi, everyone, and welcome to Ask the Horse Live. I'm your host, Haley Kerstetter, digital editor at thehorse.com. Equine osteoarthritis, or the degeneration of cartilage and bone in a horse's joint, is a painful condition and the most common reason for lameness in horses. While there is no cure for OA, horse owners and veterinarians can work together to delay onset and slow its progression. This event is sponsored by Arthrimid Vet. To answer your questions, we're joined by two expert panelists, Dr. Sarah Lejeune of the University of California, Davis, and Dr. Jennifer Jeune of the Feiner Equine. Welcome to both of you.
Thanks for having us.
Dr. Lejeune, can you tell us a little bit about your background?
Yes. Hi, everyone. I am actually originally from Belgium, where I grew up. I'm horse obsessed. So ever since I can remember, I just wanted to be around horses and ride horses, and I wanted to be a veterinarian. So I went to vet school in Belgium and then wanted to specialize in surgery and lameness. So did an internship in Canada and then obtained a residency in equine surgery at UC Davis, and then completed that residency and in 2003, and then stayed on as faculty in surgery, and then developed an integrative sport horse kind of service, and became board certified in equine sports medicine and rehabilitation. And so, yeah, that's all I do and have been doing. I still have horses. I breed Belgian warm bloods, and I, try to ride them and enjoy them and show jump. So that's my story.
Awesome, thank you. And Dr. Jeune, can you tell us a little bit about your professional journey?
Sure. I grew up in Chester County, Pennsylvania. I grew up in pony club and eventing, and I did that through college. And while I was in college, I became an OR tech for New Bolton, just in the surgery section during my summers. And then I went to Penn and graduated from there and went to Haggard and did an internship at Haggard in the field, and had an interest in sports medicine, but really an interest in reproduction. But I still rode and I still competed, and the sport horses kind of chose me because I was always at the shows and always doing stuff. So I got to work with some incredible veterinarians, Dr. Duncan Peters and Dr. Jorge Gomez, and that took me to Wellington, and I got to see the whole 100 jumper circuit there. It took me to the Olympics in Hong Kong. Well, it was the Beijing Olympics, but the test event and the Olympics were in Beijing, or were in Hong Kong. And then I got to do the WEG in Kentucky when it went there. I did the quarantine for that, so that was really exciting. And then I moved to New Jersey, to Mid-Atlantic Equine. And then after a couple years there, I started my own practice, the Feiner Equine, and have been splitting my time in New Jersey and Florida, 6 months and 6 months about, for the past 8 years. And I love it. I still show. Now I'm doing the hunters jumpers, which I never thought I would do. And I really like that. And I really like getting some broken horses and finding them new jobs and trying to fix them. That's what I love to do. So my kids now show and ride, so it's been great.
Awesome. Before we begin answering questions, I want to remind everyone of our Ask the Horse Live format. We're starting with questions submitted during registration. If you're listening live and would like to submit a question, please do so via the chat window. We'll do our best to get to as many of your questions as possible. If you're listening to the podcast recording of this event and would like to join us live in the future, please visit thehorse.com/askthehorselive to register for notifications. And with that, we're going to jump in. Dr. Lejeune, our first question is for you, and it's from Jennifer in Kentucky, who wants to know what proactive steps horse owners can take for young horses in training to protect their joints against osteoarthritis later in life.
Thank you for that question. So I would say there's many factors that can help. Unfortunately, not one thing is better than the other. I would say you probably have to do all of it. And so to start with, balanced diet. So making sure the animal is not too fat, I know that's not popular to say, but that's really important because that decreases the forces on all the joints and all the feet. So decreasing, the amount of calories, so no excess carbs, but then also making sure that, the nutrition is balanced, no copper deficiencies, zinc excess, things like that. Calcium phosphorus balance is good. So, balanced diet is really important. Then balanced chewing, because, the interaction with the ground is critical, and minimizing concussion is really huge. So that's really important in making sure that, you're maximizing the quality of the footing for whatever discipline you're doing, and also cross training so that the horse is adapting to various different footing and exercises. So also in terms of the exercise, making sure that they're exercising regularly and to a level that is adequate for their training. So, you don't want to overdo it one day and then they're really sore, and then, you want to kind of spread it out and make sure they have adequate rest days in between, making sure you have proper warm-ups and cool downs, that the horses are not, being lunged excessively if they're high. A lot of turning and torque is not good. So, making sure they actually have, some turnout so that they're happier athletes and not wanting to just go crazy and, put a lot of stress on their joints. And then, getting into things like nutraceuticals can be helpful. There's some controversy about that, but, some supplements that include glucosamine and cosequin can be of benefit, and the omega-3 versus 6 fatty acid balance, that's getting back to diet, is important. And then things that you can talk to about your veterinarian, certain injectable joint, systemic treatments like Adequan or Pentosan, the glycosaminoglycans or Legends. All of that is relatively non-invasive and is certainly part of what you can do to help prevent joint disease.
Awesome. Dr. Gruen, Grant in Florida asks how veterinarians decide what joint product to use for joint injections. When would they use a steroid or orthobiologic polyacrylamide hydrogel product, or is one better for preventing joint disease?
Yeah, I love this question. It's a lot. We could probably talk about it for an hour, but I think the most important thing is that it depends. It depends on your horse's age. Do you have a young horse that is just a little sore and it's a hardworking hunter? Do you have an old horse that is starting to get stiff and slow down? Is your horse metabolic? Is it overweight? Is it laminitic? Do you have an upcoming show? Like, what type of time frame are you on? Do you need results like in 2 weeks? Do you need results tomorrow? Do you just want to keep your horse comfortable? And what are you trying to accomplish? Are you just trying to get to the next show and then he's going to have some time off? Are you trying to keep your horse comfortable just so you can do some low level work? I think those are all important things to consider. And finally, your budget. So saying all that, steroids are cheap. They are effective. They work really quickly. And that's why a lot of people reach for them, because you can get the effect you need fast, and it's reliable. Orthobiologics are also fantastic, but orthobiologics are a lot more expensive, where you'd be spending for just the steroid alone like $60 to $80. You're going to be spending up to $1,000 for an orthobiologic. So it's a huge difference. The difference too is that an orthobiologic isn't going to break down the joint like a steroid would. So if you have a young horse, you might want to reach for the orthobiologic. Or if you are trying to compete at the FEI level, or you're showing soon, you might reach for the orthobiologic, because steroids depending on which one you use, has from betamethasone a 7-day withdrawal period for FEI, or a 28-day if you're using Dipl, and that's just the bare minimum withdrawal period. So that's important. You know, what shows are we trying to do? How far out are we? The polyacrylamide hydrogels I use a lot. I really like them because I feel like it integrates into the joint and the joint capsule. It's good for young horses because it makes that joint capsule a lot more elastic, so you don't get the fibrosis. And I think synovitis is really the most important factor causing pain in osteoarthritis. So if you can treat that with something like a polyacrylamide hydrogel, the two are Arthrimid and Noltrex, you know, you get your joint injections to last longer and maybe calm this whole process. You know, preventing joint disease, I think if you can find the root of your inflammation and you can decrease the joint inflammation early, you're going to prevent joint disease down the road. Also, if you have joint disease or if you have inflammation in the joint and you can give that horse either time off or you can decrease their workload for a little bit, that's also going to prevent the bony joint disease, the bony arthritis that we see down the road.
Dr. Lejeune, Cindy in California wants to know if there are any natural preventative joint care strategies that she can implement for her 18-year-old mare.
Yes, absolutely. So, I mean, it's kind of like the first question. There's, you know, things you can do that are just, you know, common sense that are going to help no matter what your horse's age is. And that would be, you know, weight management, making sure they're not too fat, good diet, the balanced chewing, regular exercise on good footing. I mean, all of those things are important. But then, of course, there's a myriad of nutraceuticals out there that have, you know, not a lot of research. I mean, that's the bottom line. I mean, there's been some support for glucosamine chondroitin and avocado soybean extract in horses that has actually been shown to be beneficial. But there's a lot of others that are being used that seem to be effective, but there's, you know, no real data behind them. But certainly, you know, using arnica topically is something that, you know, you can do, or any kind of supplement that has frankincense, that can be effective in decreasing inflammation within the joints. I just caution you that you don't want to use that in pregnant mares. Same thing for devil's claw. There's research in humans, but not so much in horses. So again, not something you want to use in pregnant mares. And if you are showing, that can test positive. So you want to make sure that, you know, you respect adequate withdrawal times, which are not always known for some of these nutraceuticals. So you do have to be a little careful. So turmeric is another one that seems to be beneficial, but again, no data in horses. And then white willow, which sounds, you know, like all of these things are obviously natural, but there is, you know, the ingredient within it, which, you know, has been purified in, for instance, the white willow is salicylate, which is actually aspirin. So that is actually a potent anti-inflammatory. We know that. The benefit of using the white willow, it seems to be easier, like there's less side effects on the GI tract, like gastric, you know, ulceration, etc. with it. But again, you know, no research really in horses at this point. But all of these things are things to consider, and I would certainly, you know, discuss it with your veterinarian because there can be interactions with other substances that you might be giving. So, you know, you don't want to just assume that because it's natural, it's safe. And so I would always, you know, have a chat with your vet if you're going to use some of these things. But, you know, there are options out there that are, you know, somewhat effective, probably also dependent on the horse and the severity of the problem, and that are natural.
Dr. Jeune, Kathy in Ontario says that her farrier noticed her horse is stiff when he trims her. She has trouble bending her knees and holding that position. Is this an early sign of joint disease?
Hi, Kathy. Okay, so this is a really good question. First of all, it can be. I think this would be, if your farrier's noticing this decreased range of motion when he trims her, then I think it's time to talk to your veterinarian and schedule a performance evaluation. I'd want to know, how old is your horse? What's its job? What's its job been in the past? If this horse is a standardbred or a thoroughbred off the track, then absolutely, this is a early or maybe even a later sign of joint disease, depending on if you've had x-rays taken before. That being said, take the x-rays. So what happens in joint disease is that you get excessive or chronic repetitive stress. And what that does is it tells the joint, like, hey, we need some help here. So the joint capsule then tells the synoviocyte to produce more synovial fluid, which is the lubrication aspect of the joint. So it produces more synovial fluid, and then you get something that's called effusion. So effusion just means excess fluid in the joint, and that you can see it's like a spongy, like a fluidy filled feeling, and you can see it in their knees. It's pretty easy to see once you've seen it once. So they get this effusion. It causes stretching of the joint capsule, and that's that synovitis that we talked about earlier, and that is what generally causes the first signs of pain in osteoarthritis. So that then will cause fibrosis of the joint capsule. And then when your farrier picks up that leg and stretches that joint capsule, that's when you see that pain. So yes, I would act on it. I would say, thanks to your farrier, this is great. Let's see, maybe we don't even have any bony arthritis yet, but now's the time. These horses that are positive deflections, that's basically what he's doing. He's causing stress to that joint. They respond really, really, really well to any kind of joint treatment. So either you're going to use that orthobiologic that we talked about before, you can use the polyacrylamide hydrogel. Those, it works really, really well on. They respond so well, and you don't even have to put any sort of steroid or orthobiologic in my experience. So if your horse is laminitic or metabolic or any of those things, you could use that and not have to worry. So I think that would be great. So I say, yes, it is an early sign of joint disease, or could be. And yeah, I would talk to my veterinarian and say, like, hey, let's just get a baseline here. Let's see if my horse is actually lame, or is he just a little stiff? And now's the time I think we need to get in there and make a difference.
Dr. Lejeune, Jacqueline in Victoria wants to know if Pentosan might be a good preventative joint care strategy for her 4-year-old event horse with no clinical signs of joint disease.
Yes, I think so. Again, I would run this by your veterinarian, but we now have FDA approved Pentosan in the US called Zycazan with a Z, Zycazan. And it is FDA approved for the control of clinical signs associated with osteoarthritis in horses. So it's given once a week in the muscle for 4 consecutive treatments. It's safe. It seems to be effective. The studies were pretty convincing, and I think it would be a good option. I typically recommend to do this twice a year on the horses as a preventative strategy. But again, I would certainly run this by your vet, because this has to be prescribed by a veterinarian. But yeah, great option.
Dr. Gruen, Jen in New Jersey asks if 2.5% polyacrylamide hydrogel might be effective as a preventative measure to protect her young performance horse's joints from joint disease later in life.
Okay, I've already spoken about this a couple of times, but I think this is, again, good. So 2.5% polyacrylamide hydrogel is Arthromid. That is the name of that, the polyacrylamide hydrogel. And yes, I do think that it will protect her young performance horse's joints. The reason is because it binds to that joint capsule, like we talked about before. It binds to the synovial lining by the macrophages grabbing hold of that polyacrylamide hydrogel. It takes it in, into the joint capsule itself, and it becomes part of the joint capsule. Now, this takes about 14 days to happen. But then those joints are 20% more elastic, the joint capsule, 20% more elastic than a normal joint. So at that point, you're going to have less inflammation because that synovial capsule, the joint capsule, is not going to be stretched to produce more synovial fluid. When you produce more synovial fluid, that synovial fluid isn't as good as normal synovial fluid. It starts to get thin. It starts to get watery. So then you're not having as good lubrication on your joint. So you're not protecting the cartilage as well. Then you get cartilage thinning. Then you get bony sclerosis, meaning hardening of the bone. So it's like if you're a runner and you wear the same running shoes every single day and you're running marathons, you start to lose that cushion in the cartilage, and then you're starting to get friction. That's when you're going to start to get bony change. So I think, yes, whatever you can do to start early is a good thing. And there's no steroid when you do that. So you're not causing any sort of breakdown or metabolic change in that joint. You're just trying to decrease the synovitis and increase the elasticity of that joint. So yeah, I think it's a great idea.
Dr. Lejeune, Sarah in Ontario wants to know how long a horse can stay on firocoxib. But first, can you explain what the drug is and why veterinarians might prescribe it?
Sure. So firocoxib is, a lot of people know it by either Previcox, because that was the dog form that we were giving to horses, because horses are way more sensitive to it, actually. So you can take a large dog tablet and you'll have 4 doses for a horse. Or now we have we're not supposed to do that anymore. So now we use Equiox, which is exactly the same thing, but it's actually for the horse. And this is a non-steroidal anti-inflammatory drug. So it is like butorbanamine. It's in the same class of drugs. So it's not just a little, nutraceutical. It is actually a drug. And so it's very effective in controlling pain and inflammation. And actually, it's labeled for the control of pain and inflammation associated with osteoarthritis, and it can, the efficacy is up to 24 hours with just 1 dose. So it's quite convenient. It's probably not as potent as butorbanamine, but a lot of people put their older horses or the ones that are a little creaky on this. The advantage of firocoxib versus like butorbanamine is that it's safer on the system, because actually it only affects some of the cascade of these inflammatory pathways that is actually detrimental, and not a lot of cell signaling, which is involved in coagulation, gastric blood flow, renal blood flow, etc. So it is a lot safer for the GI tract, the gastrointestinal tract, and for the kidneys than like butorbanamine would. And that's why a lot of horses do stay on it for quite some time. Now, it isn't completely safe. It is a drug and it is having some effects. So we do recommend that you would monitor the horse's blood work, specifically looking at like protein, plasma protein, and then the kidney values to make sure that it's not being affected. And that really depends on the horse, depends on, what your veterinarian recommends. But I would say, at least every month you should do that. Some horses do stay on it for a really long time. And I would say, yeah, you should be having a conversation with your vet about that. And they should probably at some point monitor the blood work of these horses to make sure that they're not being affected negatively. But it's hard to say how long horses should be on it. It really is dependent on each individual horse and what's going on with them. And certainly we see horses that have been on it, for months and months and months. But I think it is important to make sure that they're being followed and that, you're not noticing a lot of urination and a lot of drinking, that would suggest that maybe the kidneys are being affected by it, or, they're a little bit more finicky about eating, which would suggest maybe that they're having some gastric issues. So I would just say you should always have conversations with your veterinarian about this before you just forge ahead, because it is a drug. It isn't just, a little candy or a cookie that the horse can have daily that's going to make it feel good.
Dr. Jeune, Christine from our live audience has a 15-year-old horse whose hocks are fusing. The horse is coming up lame 3 months after hock injections. Christine is wondering if shoes could help the arthritic hock joints after injections, and the horse has been unshod for 3 years.
Well, that's a good question. Okay, so your main problem, Christine, is that your horse's hocks are fusing. So it's not so much that you need shoes behind, it's that when they're starting to fuse, you have massive arthritis in the hocks. That's what that means. In your distal intertarsal, in your tarsometatarsal joint, those are the bottom two joints, the lower two joints that get arthritic and they start to fuse. Your joint injections don't work like they used to. So once the joint fuses, you're cream cheese. I mean, the horse isn't going to have pain. It will do great. So what my suggestion would be is, yeah, I mean, if you feel like your horse is unstable when it stands, if it puts its foot down and its hock shakes and you think he needs a little bit more stability, a wide web shoe behind would certainly help you and give you some good heel support. I think that would be great. But you may just have to treat that horse, and I would use a corticosteroid. You may just have to treat that horse a little bit more often, because what you want is you want that joint to fuse. So you're going to kind of aggravate that cartilage a little bit so that it wears away, because as long as the cartilage is there and the bone can move from side to side, that's going to cause pain. So what you want is that cartilage to kind of go away. And your other options are, A, put a steroid in there. B, you can put a polyacrylamide hydrogel in there. That a lot of times I find in my own practice with some of these horses that I know its joints are fusing, like, yes, okay, that's a little counterintuitive because you're going to make the joint capsule more elastic and trying to prevent arthritis, but it does make them feel more comfortable in the meantime while the joints are starting to fuse. So do the steroid, maybe a polyacrylamide hydrogel, maybe a wide web shoe behind. I think that's not a bad idea. And if it gets bad enough, you can always go the surgical route. And I mean, I'd love to hear Dr. Lejeune's experience, but you could take your horse to surgery and they can fuse the joint. In my own experience, I've not had great experience with this. I've seen it done, and they weren't my cases, but I have seen it done a couple of times, and the response really wasn't favorable. I think it's better to go ahead and let the joint fuse on its own. But that is an option for you while, your horse is painful. But in the meantime, I don't see any reason why, as long as he's not metabolic and depending on what job you want him to do, go ahead and treat that joint so that he's comfortable. Put him on an NSAID, put him on Equiox. Equiox works great for hocks, and you can keep him on it. You can show on it as long as you're not showing FEI, and as long as you're not using butyrbandamine when you show. You just have to use the firocoxib. So, I mean, I think those are all your choices. I don't think shoeing, though, just shoeing is going to fix your problem. I think you are in a waiting game. So, do the best you can to make him as comfortable as you can until that hock fuses.
Dr. Lejeune, did you want to add anything about the surgical aspect of this one?
Yeah, so there obviously, yeah, there are surgeries to help fusion. So you can drill out the cartilage in the joint. You can you can laser the cartilage. You can actually inject the joint with alcohol to destroy the cartilage to accelerate fusion, and you can also place screws and plates across the joints. And I agree with Dr. Jeune that, I mean, it sounds like in theory it should be good because it will stabilize the joint and decrease the torque and pain, but usually the success is not that great, and the horses will have chronic lameness. So I'm exactly of your opinion that I would much rather let the natural process occur and speed it up by injecting the joints as much as possible, maybe shock wave. I am actually a proponent of shoeing in those cases just to make sure that, they are balanced, and, if for sure if they have negative angles behind. So if their coffin joint is unsupported and they have, very little heel, I mean, that can make them quite sore as well. So I think whatever you can do to establish good balance and support is good. And then making them comfortable enough that they are exercising so that you are stressing the joints enough that they are going to fuse. And I mean, it kind of depends on the horse, but sometimes they have to get they're a little uncomfortable for a while, and then, hopefully once they're really stable and fused, then they're fine. But I would say that the surgical procedures are not as successful as we would like them to be. So I think medical management is by far superior.
Dr. Jeune, Claudette in Ireland asks if you can discuss warm-up and cool-down techniques that can help support a horse's joint health.
Sure. So I think a proper warm-up is really important. And why this is because supporting your joint, every joint, are your collateral ligaments, just all your ligaments, and soft tissues. And I personally think that warming up the soft tissues is going to make your horse much more comfortable. You'll be less prone to injury. You'll warm up the joints as well, but really it's the soft tissues that support all of that, because joints are great. Joints we can treat, they will respond, they will get better, and we can keep going. The soft tissues, I mean, once they go, you're looking at time off. I mean, in some cases, it's forever time off. So I think your warm up is important. And so what I suggest to my clients, especially those that have concurrent joint disease and soft tissue disease, which happens a lot, especially in fetlocks, because your suspensory branches are right there and they are so close to the joint. When you have a suspensory branch injury, even if you can't see it, your joint starts to get effusive. So you think, oh, it's just the joint, I'm going to treat that, it'll be fine. A lot of times you have underlying suspensory branch injury. So for any of those cases, I would recommend 5 to 10 minutes warm up, and a good walking warm up. Make them use their core, make them use their hind end, because these injuries generally happen. They're injuries of exhaustion, and they're injuries when they're trying to offload something else. So they're not using their hind end, they're just kind of hanging on the forehand, or they're not stepping up behind, and they take a funny step. So 5 to 10 minutes, good walking warm up is great. And walking, you don't have to do anything more than that. And then at the end, I think it's important too, 5 to 10 minutes cool down, because you have to let those joints relax. It's like anyone else. If you're a runner, I'm a runner. So that's kind of how I think. Like, these horses are athletes, we're athletes. So if you think about yourself, the same rules apply to them. When you're finished running, if you stop and you don't move, you tie up, you can't move. If you go for a walk after you run, you feel fine. So the same applies to our horses. They are absolutely no different than we are. And I think if you treat them with your warm up and your cool down the same way you would as an athlete yourself, you won't do wrong by your horse.
Dr. Lejeune, Amy in New York asks how effective clodronate injections are and when veterinarians might use them.
Yeah, so clodronate, which is actually the name is osphos. So it's a non-nitrogenous bisphosphonate, which has been approved in horses in the U.S. And in Europe since 2014. So we have, over 10 years of experience with it now clinically. So bisphosphonates are used in human medicine as well, and the thought is that you're decreasing bone resorption. And in humans specifically, it's used in women to help with osteoporosis and other issues. But it also, and clotronate in particular, has potent anti-inflammatory and analgesic properties. So that means, it does have some pain relieving properties, and we think more so than other bisphosphonates actually. So it's used in horses, is approved for horses with navicular disease. But honestly, I think it's being used off label for many other conditions because, it does have a potent anti-inflammatory effect and also a longer standing analgesic effect. And so I think, like it would be used commonly for instance, for insertional and enthesiopathies, so like suspensory branch desmitis, what Dr. Grun just mentioned would be a good one, or suspensory origin issues, desmitis, back pain, neck pain, other types of joint pain, bone spavin, we've been talking about that, would be a great candidate. I mean, it's quite safe, and the studies are pretty convincing, but it doesn't work, overnight. So you're looking at a month at least to see an effect, and that would last for upwards of 6 months. So it kind of depends on what you're dealing with, but you're looking at a longer term effect. So the one thing that I will say is you've got to be careful when you're using it because it is really kind of tough on the kidneys. So, it shouldn't be used on horses that are concurrently at the time on, for instance, Equiox or the Firocoxib or any kind of anti-inflammatory like buterbanamine. So you do want to make sure your horse isn't on that when it's being administered this. And I think ideally it should be screened, make sure that it doesn't have underlying kidney disease because that could be not, that could be bad. But otherwise, it's quite safe. I mean, the horses can get a little bit crampy short term. It's a little irritating locally, so they might object to it, be a little irritated, but it's a very short-lived kind of effect. And all it takes is to take the horse for a little hand walk or a hand graze, and they usually get over it. So I do think it's a really good option depending on what you're dealing with, and quite safe. So definitely something to discuss with your vet.
Dr. Grun, Peyton from our live audience would like to know how current treatments for joints in horses' limbs differ from treatment for issues like kissing spines and facet joint degeneration.
That's a great question. Okay, so we have in the horse, there's 3 types of joints. There's the synovial joint, which is the most of your joints in your horse. Your hocks, your fetlocks, those are synovial joints. You have fibrous joints. Those are the joints between the bones in your skull, which we don't treat. And then you have cartilaginous joints, the bones that are connected by cartilage, like in the spinous processes and the vertebrae up there. So when we're treating things like kissing spine, well, we're not going to put in, I don't put in any sort of HA product or a polyacrylamide or any of those things because what we're trying to do is just decrease inflammation. So, I put in something like a Predef, which is a steroid, Serapin, which is a neuroirritant. And what that does is it irritates the nerve in a way that it reduces it from firing, which causes chronic pain. So in that, I think other great things to do other than just injections, you could do shockwave. That works really well. Again, it downregulates those C fibers. It increases circulation to the back. So it brings in all sorts of things, decreases pain, totally invasive. I think this works really, really well in back. So the other thing would be that I use all the time is the laser. Laser does the same thing, decreases inflammation, it gets rid of pain, completely non-invasive. It brings stem cells to the area. It causes angiogenesis, so it brings blood vessels to the area, and it lets the body get rid of inflammation in its own way. Also, acupuncture, chiropractic, those things are great. acupuncture especially. I like to do it, so I can just speak from experience. I think it's really good for back pain. So instead of just treating the joint like I would a fetlock, where I would put in either an orthobiologic or a steroid or a polyacrylamide hydrogel, and I'm treating the joint, here I'm treating the surrounding musculature, the epaxials, but really what we're targeting. And then you treat the dorsal spinous processes themselves as well, and that's where you use the steroid. But I think you kind of have to use them together. Another great thing for backs is OSPOS, what we just talked about. So I think that works really well. It stops that bony change in the back, the bone resorption, which is painful. And these horses feel so much better. So there's lots and lots of things we can do with the back. And it's not something like your normal synovial joint that you want to only go into, once every 6 months, once a year. You can get into the back, and with repetitive treatments such as shockwave, such as laser, you can really get rid of back pain. The other thing you really have to do, which we can't do in joints, is make sure that your equipment fits appropriately. So there's lots of saddle pads out there that help. A properly fitting saddle is key. Also, the weight of the rider is important, and maybe that's not right to say, but it is, especially these horses with kissing spine. If it's a really heavy rider, that's going to put a lot more pressure on the back. So if this is a horse that needs to go for a long time, maybe that's something that needs to change too. So I think it's important. Backs in general are degenerative, so they kind of get worse over time. So it's important to kind of be aggressive, treat those early, and do what you can.
Dr. Lejeune, Julie in Arizona wants to know if larger horses are more prone to joint disease than those that are smaller or ponies.
That's a great question, and I don't think there's any real data on it to say that larger horses are more prone, but when you think about it, it would seem like maybe they are, because the weight on the different components of the joints in larger horses are going to be so much larger than on smaller ones, and yet the cells still have the same size. It's like they're not different. So I don't think we know that for a fact, but just thinking about, force equals mass times acceleration, like the higher the mass, the higher the force. And so a lot of the joint disease that we see, or soft tissue, or any of the degenerative things that we see, are usually repetitive overuse injuries. It's not usually one bad step. It's usually, an accumulation of stress onto the structure, which then is overwhelmed and can't repair it. And so it makes sense that if you think about it that way, that a larger, heavier animal would sustain more stress than a smaller one. And so maybe they are, but I can't say that for a fact. And I don't know if Dr. Jeune knows otherwise.
I think the heavier horses are much, in my experience and in my practice, the larger the horse is way more prone to joint disease than those that are smaller. Just as you said, they're just bigger, more massive. They're harder on themselves. The concussive force is stronger. So yes, the bigger horses, in my opinion, yes, those are the ones. They don't generally last as long. They end up with lower neck pain, foot pain. I find that those horses do tend to have more joint disease.
Dr. Jeune, Rose wants to know what ring bone is and if there's any way to predict or prevent it in horses.
Okay, Rose, ring bone is arthritis. Either it's in the pastern, high ring bone, or in the coffin joint, which is low ring bone. A lot of these horses have it. So what predisposes your horse to ring bone? There's two things. Conformation, so these upright pasterns, like little quarter horses, they are much more concussive. The forces are much more concussive on the joint, where a long sloping pastern, it's a lot more tendon. That's where the the force goes to your tendons. So short pasterns, concussive on the joint. Pigeon-toed horses too, a lot of concussion on the inside of that joint. So conformation, A. And then repeated stress causes arthritis in these two areas. So the horses you see it in are hunters and jumpers, the barrel horses, polo ponies. The barrel horses and the polo ponies, I think a lot of it is because it's repeated stress on a horse with very upright conformation. On our hunters and jumpers, it's the landing side all the time. Those horses, the hunters and jumpers, at least that's primarily what I deal with. They have conformation that is a long sloping pastern, so they take a step and flick their toe. But the landing side, and these horses jump a lot. Especially, you wouldn't think the hunters would jump so much, but in order for them to go around the ring like a metronome and just land every jump and be quiet, that takes a lot of practice. And those horses end up with generally low ring bone, I find. So once you have ring bone, what can you do once you have it? I think the important thing is, as Dr. Lejeune said before, weight. These really heavy horses, it's a lot of pressure on those front limbs. You think about it, like I'd say a good 80% of that weight is on the front end. You have your head, you have your neck, and your shoulders. So it's a lot of weight. The more weight you have, the more concussive the force. So I would make sure those horses that are predisposed, that have the conformation, that upright conformation, or are in that, they show a hunter jumper or barrel or polo ponies, any of those things, after they work hard, you give them some sort of an anti-inflammatory, because that's going to decrease the inflammation. So this repetitive concussive trauma, that's what causes arthritis, and that's all that ring bone is. It's just arthritis. So other things you can do once you have it, you could do OSPOS, because it's bony change. Ring bone is what you actually see. It causes that ring, is that bony change. So the clodronate or any sort of bisphosphonate will decrease that bony change that you'll see. So that will help it. But really, once you start having arthritic change, it is a slow, insidious process. We can't, at this point, cannot stop it. So the best thing you can do is either take that horse down a notch in its job, find it a different job, or give it some time off.
Dr. Lejeune, Mohammed in Iran asks if hearing a clicking sound in his mare's front limbs when she walks could be an early sign of joint disease.
Great question, Mohammed. So it really is interesting, this clicking that we hear sometimes. And we have it too in our joints, and so it really depends on the clicking. So just some little, a click is not necessarily pathologic. So it can be normal. It can be just cavitation of gas bubbles within the joint that are caused by excessive force within that joint. That can just be normal movement. So people who crack their knuckles and stuff, and when you have that sound in humans, they've actually looked at those joints and they were not more pathologic than joints that didn't click. So that, in that sense, I would say not necessarily, but we have seen, and I'm sure there are horses all over the place that are clicking and that do have early onset OA, or that have some kind of a mechanical component that is causing that clicking. So I would say, it needs to be checked, because it kind of depends. Not necessarily pathologic, but could be.
Dr. Jeune, Carrie in British Columbia recently bought a horse that vetted well with no signs of joint disease. What can she do now to keep him sound for their future?
This is a good question. So I think it goes back to what Dr. Lejeune said in the beginning. I think number one is shoeing. no foot, no horse, and that whatever hits the ground radiates all the way up the limb. So I think shoeing is really important. And if that horse is barefoot, great. I would still consider doing balance radiographs. We do these a lot, especially in my practice, where you just take a lateral and a DP. A DP is a front to back view, and you make sure the foot is balanced. Because when the foot is out of balance, that is going to stress one side of the leg more than the other. And it's no fault of anyone. The horse just grows one way. And especially if the horse has uneven conformation, which most of them do, has a high heel and a low heel, those horses are really hard on themselves because they don't wear evenly. So then they're offloading pressure onto their good side usually, and that's the one that becomes arthritic. So I think number one with a bullet is shoeing. No foot, no horse. Balance radiographs. They're easy to do. They're not expensive. Your veterinarian can come in. If you could do them twice a year, great, because the foot's constantly growing. So you're not trying to insult your farrier, and the farriers love these because they cannot see what the bony capsule looks like inside the foot. So do that. Easy. Other things you can do to keep them sound. I wish we could just say, like, just do this and they'll be sound forever. You won't ever have a problem, but we don't. That's why we treat our horses. So I think the important thing to do is, since we can't look into the future, is that you do performance evaluations a couple times a year. You could do them once or twice a year. Just a performance evaluation to me is a lameness evaluation where you have your veterinarian come out, watch the horse jog in hand. You do all your flexions. So you flex the front end, you flex the hind end, you watch the horse ridden, you watch the horse on a lunge line, because you may not feel these subtle lamenesses. And until someone, really stresses the joint, you might be missing something. And you might be missing something to a point until the horse is lame. If you can catch these things early and you can keep that horse sound and you can keep that horse even, like we said before with the shoeing and the balance, you can keep that horse even, he'll stay sound longer. The other thing you can do is remember again that osteoarthritis is caused by chronic repetitive stress, chronic repetitive injury. So if you don't have to jump that horse every single day and you can vary the surface that you are riding on, those horses will stay sounder. And that you give your horses off days, then maybe, once a year they get a downtime, a break, just so those joints can recover. All these things you can do to help keep that horse sound for a really long time. And after you jump them hard or whatever you do, whatever your hard day is, treat that horse well. So what I mean by that is put him in ice boots, do up his legs, either a sweat or a poultice, anything you can do to prevent inflammation. Inflammation is not your friend. So if you can prevent that inflammation, you're going to keep that horse sound much, much longer. And then again, shoeing in your feet, your foot balance. It all starts at the bottom. 90% of lameness is in the foot. So if you can address that, you're going to be on your way.
Dr. Lejeune, Jane Ann in Missouri wants to know if putting boots and wraps on her horse can help prevent joint disease. Okay, Dr. Gruen, do you want to take that question?
Oh, sorry, I was muted. Wait a minute. Sorry,
okay.
I started talking and I forgot to unmute myself. I'm sorry.
You're fine.
So I was just saying that great question, but there's two scenarios. So one is having boots or wraps on during exercise. That I'll answer that question first. And then there's the other scenario, which is what Dr. Gruen was just talking about, is where you're, wrapping the horse in between or after exercise. So in terms of putting boots on during exercise, there's two things you got to think about. One is, why are you doing it? Because if you're just trying to prevent the horse from traumatizing itself because it's interfering, or you're jumping and you want to protect the legs, I mean, that's a consideration that is valid. But anything you're going to put on the legs is going to heat up the tendons, and that is not good. And that will predispose them to actually soft tissue injuries, which, if the soft tissues aren't adequately supporting the joints, you could, theoretically make a leap towards the fact that that could predispose to joint disease. And so I think the bigger thing is, soft tissue, and there is a link there that we can see because of the heat generated within the tendons during exercise. And so there have been studies there that show that actually polo wraps are the worst possible thing you could ever put on a horse's legs during exercise, because the horse's legs increase in heat tremendously, and all this heat is not good. And, because down the road, then what we want to do is cool everything, because we want to decrease inflammation. One of the hallmark signs of inflammation is heat. So anyway, the bottom line is you can see where this is going. There's no, it's not a yes or no, black or white answer. If you're doing it to protect the legs during strenuous activity, jumping, if it's a horse that interferes, do it, but recognize that you are probably going to have some heat generation that isn't going to be able to be dissipated, and that will probably not be ideal. Now, after exercise, absolutely, cooling everything down, putting them in ice boots is great, because you want to decrease that inflammation. And then again, keeping them in poulticing, various poultices is good, again, to decrease inflammation. But just placing wraps on overnight, again, the question is, why are we doing it? Do we really think it supports the soft tissues? It probably decreases some, edema, distal limb edema in the legs. So for horses that are prone to that, I think it's probably a good idea. But again, keeping those structures warm is probably not ideal. So there's always a trade-off. So I'm sorry it's not a straightforward answer, but during exercise, think about why you're doing it. And if you really need to do it to protect the legs, I think it's good. After exercise, absolutely cooling the legs is going to be important, doing whatever you can to decrease inflammation. And if you really need to support, the soft tissues and decrease edema, then do it. But I wouldn't just put on bandages just to do it. I mean, you got to think about why you're doing it. And again, have a conversation with your vet about it. I think it's always a great plan.
Dr. Jeune, we're coming to the end of our time tonight, so this will probably be our last question, and it's from Dana in Minnesota, who asks if horses with EMS are more likely to develop joint disease.
Ooh, hard question, Dana. Let's see, horses with EMS. Well, horses with EMS, equine metabolic syndrome, what they have is they have an excess of, well, a couple things. They are usually overweight. They usually have an excess of insulin hanging around their body. Insulin is toxic to the lamina in the feet. So, yes, the short answer is yes. Horses with equine metabolic syndrome generally are more prone to joint disease. The bigger problem is horses with equine metabolic syndrome are really hard to treat, because we do not want to treat them with steroid if we can help it, because they have too much insulin in their system. Generally, those horses with metabolic syndrome are also cushingoid. They have too much steroid hanging around their system already. So the chance of causing laminitis is really high. Not great. So yeah, I do think equine metabolic syndrome is tough. Those horses we usually use the orthobiologics on. We use a polyacrylamide hydrogel. Those are great because there is no steroid and those horses respond really well. But really keep those horses a little bit on the skinnier side, because the heavier they are, the more stress on the joint, the more you're going to want to treat them, and you don't really want to do that.
Well, that's all the time we have for tonight. We've covered a lot, and I hope our listeners have learned as much as I have. Thank you, Drs. Lejeune and Jeune, for joining me tonight.
Thank you for having us.
Thank you.
Dr. Lejeune, I learned so much from you.
Oh, I learned a lot from you. It was really fun. Thank you.
And thank you to Arthur Vet for sponsoring this event. Finally, thank you to our audience for listening and sending in all of these questions. If you're listening to us live after the event as a podcast episode, please rate, review, subscribe, and recommend Ask the Horse Live to a friend. Until next time, from everyone at the Horse, have a great night.